Hello, everyone. Welcome back to another episode of the AI Healthcare Podcast. I'm your host, Dylan Reed, and today we're joined with my friend, Abraham Obianke, who's a medical student at Ambrose Alli University in Edo State, Nigeria. Thank you so much for your time today, Abraham.
Thank you very much for having me, Dylan.
It's a pleasure for you to be here all the way from Nigeria with the time difference.
Yeah,
um,
yeah.
and what made you decide to pursue the medical route in AI healthcare?
Okay, being a medical student, I saw the various challenges in the healthcare system, and particularly in my region also, where we face various challenges due to lack of modern medical equipment and some other uh, challenges like scarcity of medical professionals also due to immigration. And also, the I saw the various challenges also facing the healthcare system caused by misdiagnosis, doctors burnout. This severely impact the treatment of patients, and I was curious to know how possible it is to address some of these challenges to improve patient outcome. So that curiosity led me into the use of artificial intelligence to improve these these processes. So that was how
Mhm.
I got into artificial intelligence as a medical student.
And when you say shortage of medical equipment, is it like do you tend to notice specifically in Nigeria that certain types of medical supplies are more in shortage than others?
Yes, definitely. So there are some resuscitation equipment that uh, that 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 is used in developed nations that are not available in Nigeria. For example, like a few months ago, a child died because a child died because there was not the child had an issue while I was in the hospital. The child had an issue. He was taken to the ICU unit, intensive care unit, and because of failure of an equipment to keep the child resuscitated, the child was having heart failure. But due to the failure of equipment to keep the child resuscitated, the child died. So due to all these lack of equipment, failure of this modern equipment, it has it has it has brought about a kind of a kind of lack in healthcare delivery.
Mhm. And specifically with the shortage of medical equipment, do you also see that there's a shortage of specialists within Nigeria too as well?
Yes, I would say that because most of the best of our the best doctors in our nation, most of our best brains actually do very well in the UK. They are the best surgeons in the UK, best surgeons in the US, as I've seen from the news, because they are not duly compensated as a doctor should be compensated, and so they seek for greener pastures where their skills are greatly valued by the government, they are greatly valued by the people. So because of this lack of compensation of our doctors, it has led to a great shortage in the
Mhm.
system.
And what is the average salary for a physician in the in on the excuse me in the country of Nigeria?
For an entry level doctor, it could be paid for uh, as $200 for entry level doctors. So you can imagine someone being paid as low as 200 level doctor for a fresh graduate. For a fresh graduate, as low as $200. It's not competitive anywhere. So that's the reason why people seek for greener pastures where their skills, abilities, talent, and training, because the training in Nigeria is very rigorous. It's not
Mm,
it's very rigorous, very competitive. That's the
mhm,
reason why whenever they go out to the UK, to the US, they perform excellently well because they are subjected to a kind of rigorous training that is not even that is not, will I say, obtainable in some parts of the world. So that's that.
mhm. And so in for example, in a common medical school class in Nigeria, what would you say the percentage of people that actually, once they graduate the program, they're leaving the country of Nigeria and they're going to other places around the world?
Well, the percentage of people, I haven't actually conducted a statistics, but most people who most of my colleagues who kind of like look the current system and the way doctors are being medical doctors are being treated, uh, their compensation rate and all of that. Most of them actually seek for ways to seek for other places where their talent are much more valued, much more valued. So like
Hmm.
in a percentage ratio, I would say 70% will actually look for a place to where they can be valued. Like it is said, go where you are valued, and that's what most doctors do here in Nigeria.
Wow. So there's basically, I don't want to say no, there's not an incentive to be a doctor, but there's very little incentive then based off of the $200 salary a month to actually be a doctor in Nigeria.
Well, for an entry
Mm,
level, uh, it could be in within the range of $200 to $300, $200 to $300 for an entry level. But as you progress across, there could be other
mm,
incentives. There could be other incentives, but it is not it is not it is not something that comparable to what is the obtainable global standards of what a doctor should be compensated for. So because of all of that, also it is
mhm.
something that hinders healthcare healthcare professionals from staying in the country. Also,
Wow. And you also do healthcare projects in your free time too, as well. I saw on LinkedIn you're actively involved in the AI ML space too, as well. Was there a particular project that you felt most proud about, and kind of what did you learn about how you can make an impact on the healthcare system in Nigeria and potentially on the continent of Africa?
okay, thank you for that question. The project I most that that is most close to my heart, and the project I'm most proud of is on the recently concluded project I demoed on LinkedIn, on my LinkedIn page, which is fetal health risk detection. So I particularly collected dataset from the University of California Irving Dataset Archive, which was labeled by expert obstetricians. And I walked through this data set to end with a machine learning pipeline to create a solution for detecting fetal health risk. So this project remains close to my heart because it not only captures my locality, it not only captures my Nigerian background, it captures one of the United Nations Sustainable Development Goals, which is
Mhm,
SDG Goal 3, particularly on ensuring well-being, health and well-being for all, together with eliminating preventable under five deaths. So I believe if I could take on this initiative, work on it on end to end, I can significantly make impact in my nation Nigeria and in Africa as a whole.
Mhm. And you kind of alluded it to what you just said, but could you, um, explain what was the research question that you had and, kind of the results from that study?
Okay, I think there was network a brief okay. I think there was a brief network break there. So from the research question I had, I checked on the UNICEF's page and I saw a problem statement uh, UNICEF made about in 2022 about is it about 4 million children dying in a month, comparable to about over 6,000 deaths per day. Over 6,000 deaths per day. That's a whole lot on a global standard. Over 6,000 children dying per day. So, and these were actually preventable deaths. Preventable deaths that if it could have been detected earlier, the medical professional could have seen time to seek seen time to prefer treatment. If the mother could have seen earlier, it would have sought medical intervention earlier to prevent that mortality. So in a so that problem statement I got from the UNICEF, I
Mhm.
then decided to look for a data set regarding that, and I collected fetal health data from the University of California Dataset Archive. And according to the University of California, the dataset was labeled by expert obstetricians. So that was the model I developed, and it achieved a remarkable accuracy of greater than 90%. I tested it with an external input, and it it gave a valid predicted outcome.
Wow, that's amazing. And was that your first project you worked on as a medical student?
Okay, I have been in the field of artificial intelligence for over 3 years of now, continuously
Mm.
learning and also unlearning some things also. So I've worked on several projects. I've worked on life expectancy prediction after thoracic surgery in order to detect complications after a patient has undergone thoracic surgery, to detect the complications and address those things. So if the patient, if after the patient has undergone thoracic surgery, if the patient is able to live or he may die, the physician may know that okay, let's address, since this patient is going this since this machine predicted that this patient is going to die, this model predicted that this patient is going to die, let us seek um preventive medical intervention. So I created a model around that also. I obtained relevant data set also from the University of California Dataset Archive to build a model around that also, which I also demoed on my LinkedIn page. You can see it on the featured part of my LinkedIn page also. I also built a model on hepatitis mortality prediction also. So hepatitis is a global epidemic also, affecting both developed nations and undeveloped nations due
Mhm.
to several factors, lifestyle factors, and modifiable and unmodifiable risk factors like age. So I built a model around this also. I saw a problem statement which patients have been experiencing regarding hepatitis. I also collected relevant data set from the University of California Dataset Archive, and I built a model around this. So these projects I have worked on, it demonstrates my ability to retrieve relevant data sets, identify a business problem, which is in the context of a patient, and work around that and
Mhm.
create an end-to-end solution for improvement of patient outcomes.
Okay, awesome. No, that's great. And that goes into my next question nicely. Um, so we talked about, you know, an overview of the current Nigerian healthcare system, but just out of curiosity, why is it that Nigeria has been one of the leading countries for AI healthcare innovation on the continent of Africa?
Okay, so despite the challenges we face with regards to lack of modern medical equipment, um, uh, lack of government policies that encourages public health initiatives, and some other challenges that we face as a nation. Nigerians are very resilient people. I mentioned earlier that we have one of the best brains in the UK, in the US, in the Canada, and everywhere. We are making great exploits everywhere. So regardless of because of the challenges we face, we we seek for ways to overcome our challenges. You must have heard of the saying that says that um, uh, necessity is the mother of invention. So we are faced with so many challenges that needs to be addressed, and we as a people recognize the effective role of technology in revolutionizing nations. We recognize the effective role of technology in changing our status quo. We recognize the role of technology in making our lives better. So that's the reason why because and our self-awareness, we have risen, pardon to say, as a a a technological a we have risen as a giant to address these challenges.
Mhm. And with that continued innovation, where do you see the most opportunity for AI in healthcare to make a positive impact in the Nigerian healthcare system?
Okay, with this with the opportunities in the opportunities particularly I will say the opportunities are particularly in the healthcare field, in the health tech field,
Hmm.
particularly related to the preventive medicine, preventive healthcare. So most with regards to my experience as a medical student, I've seen that most patients come to the hospital only when actually the best the best the best the best part where technology can actually help in mitigating the various healthcare challenges in Nigeria. I see that in the area of preventive medicine.
And the last question I did have is, what do you think key stakeholders or public policy officials need to understand about AI in healthcare when it comes to constructing policy and, the ability for Nigeria to be a leader on the continent of Africa for AI in healthcare?
Okay, thank you for that question. So, healthcare stakeholders, the government, and other authorities in the country, they need to understand very well that uh, that encouraging initiatives, encouraging talents, supporting them to grow is is one of the vital aspects to position Nigeria as a leading continent, as a leading country in the continent of Africa in terms of technological innovation. Support them, create public health policies, not just creating them also, but ensuring that they are implemented. Ensuring that they are implemented. So if the government can support individuals, support startups, create policies for encouraging public health, uh, give incentives if need be, give incentives to people if need be, because people are motivated when there is a likely reward to get from an activity. People don't do things because they want to, they do things out of being motivated. So if
Mhm.
the government can motivate startups, motivate individuals, motivate people with creative ideas in the healthcare space, the country will definitely be a leader in healthcare innovations.
And Abraham, where can people find more about your work?
Okay. In regards to my work, it hasn't really gone as far as I would want it to. Uh, as far as I would want it to. I would definitely like the opportunity for it to go far and wide in order for it to be adopted. Like most of the works I do now, because of the fact that I'm
Mhm.
a student who doesn't have the funds to deploy these solutions. They are in my local systems, and though this system works, I practically demo them. I can't actually deploy them because I have no funding source. I have no research grants to fund these projects, to deploy them and maintain them on cloud platforms like AWS. Though I have the experience of doing such, but because I have no research grants from
Mhm.
well from startups, individuals, and government agencies to put these projects for global usage, to be accessible to undeserved areas and everywhere, the project, the impact of the project is actually limited. So I have no self interest in gaining in having people pay for these solutions. But if government, research agencies, um, and private and public partnership can collaborate with
Mhm.
me in offering research grants and research support initiatives. I can actually deploy these solutions to make it accessible for everyone.
Mhm. And to learn more about you, they can connect with you on LinkedIn.
Yes, definitely. You can connect with me on LinkedIn. You can
Awesome.
connect with
And
me on LinkedIn.
awesome. And be sure to subscribe to the AI Healthcare Podcast on YouTube and also listen to the audio version of this podcast interview on Spotify and Apple Podcast. Abraham, thank you so much for your time today.
Sure, I will. Thank you very much for the opportunity, Dylan.
And this is Dylan Reed